If you're a doctor treating patients who struggle with obesity, type 2 diabetes, prediabetes, or insulin resistance, you need to see this video. You may have some patients who don't respond well to medication or who outright refuse to take any kind of prescription medication. Some of these patients may struggle with dietary discipline, and even though you've told them what they need to be doing, they're having a hard time getting themselves to do it. For these patients who are struggling to make progress, there's a natural alternative to prescription drugs that's pharmaceutical grade. It's in the PDR, but there's a good chance you've never heard about it. When you go to the PDR.net, you can look up any prescription drug as well as natural alternatives to those prescriptions. As you're no doubt aware, you can look up metformin, all the different types of metformin. You can also look up natural alternatives like Unicity Balance. Because the patents on this formula are not owned by any of the drug companies, there's absolutely no chance that you've ever had a pharma rep try to tell you about this product. University of Sydney did a study on it and found that it reduced blood glucose levels by 20 to 28%. Number one heart hospital in the world, the Cleveland Clinic, did a study on it with 119 patients. They said such a product, if taken regularly, could reduce cardiovascular risk on a population basis and potentially decrease the need and/or dose for lipid-lowering prescription drugs. PDR says that it promotes an increase in satiety. This is huge for people that struggle with dietary discipline. Because it's so satiating, you naturally eat less and less food. Patients that struggle with overeating, this is a game changer. About 10 different studies have shown that it improves cholesterol levels, lowering LDL and improving HDL. It improves blood glucose levels. It reduces insulin levels for people who are insulin resistant and want to regain some insulin sensitivity. It restores appropriate leptin signaling, and it reduces triglyceride levels. Because there's no medication in it, Unicity Balance is well tolerated and doesn't really have any drug interactions. It's usually used or taken together with Unimate, which is a very rich source of a dietary polyphenol called chlorogenic acid. Chlorogenic acid is amazing stuff. It's anti-diabetic, anti-carcinogenic, anti-inflammatory, anti-obesity. It may provide a non-pharmacological, non-invasive approach for treatment or prevention of some chronic diseases. The Unimate is also in the PDR. Because both of these products have been clinically proven to naturally lower blood sugar levels, you may need to adjust or perhaps even remove some of the medications that they're currently taking. I've done videos on doctors who've been prescribing it with fantastic success, and several of my TikTok followers are losing weight, their A1C is dropping, many of them women who struggle with things like PCOS, and several people have been able to reduce or eliminate their medications. It's no secret that we have a diabetes epidemic and an obesity epidemic. This protocol attempts to address the root cause, the insulin resistance. The protocol encourages people to do some intermittent fasting to keep insulin levels low and to burn fat for fuel. During this period, they can regain some insulin sensitivity, and they can sip the Unimate to help them do it. Then, prior to eating meals, they have the balance. It prevents the overeating, the glucose and insulin spikes. It blocks some of the cholesterol and triglyceride absorption. The manufacturer gives every single patient a 90-day money-back guarantee. If you're looking for options, this is a great option.